It's not unusual for us to do a fat transfer, say to the lips or to the face, portions of the face at the same time that we perform the fat transfer to the breast. So we do get some questions about it. It's something that I've been performing for nearly 25 years. I can tell you that reestablishing the superficial and the deep compartments of the facial fat, I think is important to restoring the overall youthfulness to your face as well as a real softness to the face. My philosophy has always been artistic. I want you to remain looking like yourself. I want to basically restore, the appearance that you have, not exaggerate it. So I think people have seen a lot of exaggeration, especially in a lot of the entertainers. Not my style. So I wouldn't be overly concerned with that. And for the patients, when they do or are interested in it, I again go over with them, well, here's where we can make a difference for you. Sometimes they'll bring photos in of themselves 15 to 20 years ago. We can actually see what things have progressed over that period of time so that we again are trying to restore what was there naturally. The great thing about it is, not unlike with the breast, a lot of the cells we're using can be of a stem cell or a progenitor cell, a regenerative cell origin, and those cells restoring the facial compartment help even some of the surrounding tissues, even the overlying skin. So something that can really stave off a good part of the aging process in addition to that. Now the great thing also about it is there's some real permanence to what we're doing. It doesn't mean that you stop aging, okay? But what it does mean is that people who use facial fillers to try and restore some of the volume, you're going to have to do it, every 6 to 9 to 12 months, 18 months period of time. It's something that, is quite expensive. Economically, you can restore these with your own cells and sit on things for 5 to 6 to 8 to 10 years before necessarily having to go in there and make up for some of the new differences that have occurred. So that's something, as I said, that we offer, and a lot of patients are able to take advantage of at the time that we're doing the fat cell transfer to the breast as well. When it comes to the recovery time for the facial fat, everybody's tendency towards bruising and swelling is going to be different. The more of the area of the face that we do, the more likely it is, you're going to have a significant degree of bruising and swelling. Localized areas, they have a tendency maybe to bruise or swell, but usually not quite as bad. I remind patients that when you're doing the full face, you probably need, a 7 to 10 day period of time before you're back into, kind of a cover-up makeup. Even then, you may look like a little bit of a cherub here or there. But patients, will liken it to kind of dental work that they've had and the kind of swelling they get in the early post-procedural dental work. The thing I caution patients about is that just be prepared for, as I said, the kind of bruising or swelling that may be an extreme. Make sure you've planned that within your post-operative recovery time. You certainly don't want to be back to work and making a major presentation, in that, first, well, probably 10 to 14 days. And when it comes to young children, you certainly have to prepare the young children that, mommy isn't, feeling badly at all. It may be bruised or swollen. So those are the things, as I said, that we can tell you about the procedure. But it is, as I said, very beneficial for patients who take advantage of it. When it comes to the lips, that's what we perform most frequently because there's a lot of ladies who are using the hyaluronic acid, as fillers on the lips. The thing to keep in mind is that as we age, all the tissues are aging and all of the tissues are thinning. So really what we're doing with the fat cell transfers to the lip is we're really addressing something that's a little bit deeper than the skin and the marginal levels, and maybe even into some of the muscle level. So it's rebuilding, as I said, some of the deeper tissues. You still will use, a lot of times, a hyaluronic acid type of filler within the skin or just within the margin, below the skin, to kind of top things off, to give it a little bit of that more definition that you really are looking for in regards to kind of the pout of the lip. So it's a combination of things, but by restoring some of the thickness to the deeper tissues, you'll need less of a filler and less often. Now there are certain patients too that have looked to address the back of their hands with a fat cell transfer. I've even done someone's dorsum of their of the feet at one time. But what fat transfer can restore is at least some thickness to the underlying subcutaneous tissue. Areas are going to thin, again, with the aging process. And when you lose that, then the hands will have a tendency to look quite thin, tired, and even a little bit more wrinkled. It does not take very much fat to kind of restore that underlying surface below the skin. And it's something that, again, we perform, following or at the same time we do a fat cell transfer to the breast. It's a procedure that we can do under a local as well. A lot of the fat cell transfer to the face is something you can perform under local as well. So it's not something you have to absolutely do. We do have a lot of patients who do travel in for a day, and under local we'll perform fat cell transfers to the lips, or we'll do a good portion of the face or certain zones or regions of the face. We might do their hands.